Today's episode of Arthritis at Home, we welcome Dr. Diane Lacaille. Dr. Lacaille is Associate Scientific Director, Senior Scientist of Rheumatology at Arthritis Research Canada. Thanks for joining us today, Dr. Lacaille. How are you?
I'm good. It's my pleasure. Thank you for inviting me on this exciting initiative of yours.
You know, when ACE meets with large employers, small employers, government policymakers, we often inform them that arthritis is the leading cause of work disability. Dr. Lacaille, you're one of the world's leading experts on arthritis in the workplace. Can you tell us just a little bit about the research you've conducted and the tools you've developed for employers and employees?
Well, I've become interested in the topic of employment and arthritis because it is, as you've mentioned, such a big problem. It's the #1 cause for work disability in Canada and in the US. It's really something that kind of falls through the cracks in terms of healthcare, and such a huge unmet need, because it's sort of everyone's responsibility but nobody's responsibility, and very often is not adequately addressed. And I started off many moons ago, I won't say how many years, looking at what were the factors that determined whether or not people could remain employed. And that from there sort of came research looking at the extent of that problem, but then wanting to try to, recognizing that huge unmet need, wanting to address this. And so we've developed a program specifically for people with arthritis to help people remain employed, that gives them the tools and the knowledge and some strategies to be able to stay at work. And it's called the Making It Work program. And we've just completed our randomized control trial of this program, and shown that it is effective at helping people be productive at work, and also reduces how much time off work that they take. But the trial is still ongoing because we actually have to follow people for 5 years in order to see whether it can prevent work disability. We've looked at the impact on productivity at work and days missed, but we also need to look at work disability. But we are offering the program in various capacities, so people can, if they're interested, find the information and send us a message through Contact Us on the Making It Work study site.
Congratulations on that. We know it's pioneer work. It's leading internationally research on this very important subject area. And today what we wanted to do is focus on the reopening of the provincial economies across Canada in the context of the pandemic, and the health concerns for people living with arthritis who are returning to work. We're getting lots of questions. I know you've told me in your practice you're getting lots of questions as well. We'd like to go through some of these concerns that people have. And I guess first of all, the first question is, who should return to the workplace as opposed to working from home?
The concept is, and the guidelines from the authorities are still that everyone is still being encouraged to work from home if they can. So if people can do their job just as well from home, or can do the essential duties of their job working from home, people should continue to work from home. So really the reopening is for essential workers who cannot do their job from home, because there's still a lot of essential services. For example, physicians, who are considered an essential service, are still being asked, at least in British Columbia, to continue to see their patients virtually, because we want to reduce the risk of exposure and the risk of contamination, etc. So really I think the first part of the answer is that if this reopening doesn't mean that everybody is supposed to return to work. There is still, at this point in time at least, a recommendation that people continue to work from home if they can.
If you're an employee living and working with arthritis, one of the questions you have is, do I have to return if I'm asked?
Yes.
What are the rights and obligations about returning to the workplace?
So if you are asked to return to work, so the first question is, is it safe? So, if you are asked to return to work because your employer requires you to return to work, and you can't do your job as well, or it's affecting something in the workplace if you're, if you're doing it from home. The second question is it safe? Because you're only required to return to work if it is safe. So this is a little bit of a harder answer. What does it mean to be safe? So there's, first of all, there's safety with regards to, is the workplace safe? And secondly, you as a worker, in terms of your specific health consideration of your own health issues. So if we first take the workplace, when businesses are reopening, they're all mandated to put in place some measures to ensure the safety of the workers and of the clients. And they have to have procedures and policies in place in order to reduce the risk and to really, I would like to say eliminate the risk, but depending on the type of job, there are some jobs when you're not necessarily able to completely eliminate the risk, but they have to mitigate it and reduce as much as it is in their capacity to do so. For example, in British Columbia, WorkSafe BC has and there is also so WorkSafe BC has a whole plan and some regulations around that organizations have to have developed a plan, have to post their plan both at the work site and on their website, and has to communicate their plan with the workers. And in developing this plan, they need to involve frontline workers. They need to engage health and safety board. And there has to be a mechanism by which as well, people's safety concern can be addressed on an ongoing basis. If there has to be a clear mechanism where if you have a safety concern, there's a mechanism by which you can raise it. So I'm talking for BC, but I think I think there are similar procedures in other provinces, and certainly nobody is supposed to just go back to work the way it used to be at this point in time. Everybody has to have a plan in place. So as a worker, the first thing for you is to see, has a safe plan been developed? And am I satisfied that this, from my knowledge of the workflow and my workflow, am I satisfied that this plan is truly gonna limit my risk as much as possible? And if you feel that it's not, there has to be a mechanism by which you are able to voice your concern and ask for these changes to be made. And we can talk a little more about what are the kinds of things that go into this plan, but going on the WorkSafe BC website, even if you're not in British Columbia, it's very explicitly laid out. So it actually gives you some ideas of the kinds of things that need to get looked into. Obviously, the plan, there's not a cookie cutter template because everybody's workplace is different and workflow is different, but there's some general principles to be followed. So that's the first part. So if you feel that it's not safe, you have that is one of your right. Second, now if they've done everything and the plan is in place, but the nature of your work is such that you would be in close contact to people, and depending on your own personal situation and the medications that you're on, if you have a very close contact and a high risk and you're on an immunosuppressive medication, depending on the medication, you may want to have a discussion with your rheumatologist, and you can ask for a job accommodation to be able to continue to work from home if it's possible, or have some of your tasks changed so that the essential task that you were doing, maybe somebody else can do, and you can make some changes so that you can continue working from home. Or you may have to go on, if it's absolutely impossible, you may have to go on short-term work disability or those are the kinds of options that are there for you if you and your doctor feel that the nature, it's really about the nature of the contact, how close the contact is, and whether or not you're able to wear protective equipment in order to do that job. So, if, and the general principles are, you either have to have physical distancing, and if you can't have physical distancing, then you need a barrier like a plexiglass. Mm-hmm. And if you can't have a barrier and you can't have physical distancing, then you need PPE, so personal protective equipment. And you need to have the right, adequate personal protective equipment for the interaction that you have with the person. And that's kind of the order of it. And those are the kinds of things that you need to make sure that are in place. And if for whatever reasons these things can't be put in place, and you are on an immunosuppressive medication, and not all medications for rheumatic disease suppress the immune system. So that's a discussion that's important for you to have with your rheumatologist, because your medication, you may not be aware of this, but maybe your medication does not suppress your immune system. I've had lots of patients that are, for example, on hydroxychloroquine or on sulfasalazine, and those medications do not suppress the immune system. So they do not put you at increased risk. There are others that we're not really sure, but we're not overly concerned. So things like methotrexate, we're not necessarily overly concerned. But then you get to medications like biologic agents, and then we are more concerned. So it really, I think that's why that discussion also needs to happen with your treating rheumatologist.
What about your recommendations about the safety and the issues around using public transit if you're one of those patients?
Obviously, the transit companies are being held to very high standards and are putting in place some measures to reduce the risk. But obviously, if you're taking the public transit, you're in contact with a whole bunch of people that and you have no control over. And people are not supposed to take public transit if they have symptoms, but there is still the issue that people may be in that asymptomatic phase when they don't know yet, and they could still be transmitting. They are requesting, and again, I don't know about other provinces, but I know in BC, they're requesting people to wear a mask. Well, they're recommending. So they're recommending that people wear a mask if they take the public transit. And that reduces transmission to others. In general, I would say if people can avoid public transit, I would say avoid public transit, because that is definitely a source where you potentially may be exposed, and it's a source of transmission. But recognizing that some people have no choice but have to take public transit depending on where you live and where your workplace is. And another thing you might want to think about with public transit is asking a job accommodation from your workplace, so that you might be commuting not at the time of peak transit time, so that you may actually be able to use public transit at times when there are less people. Because remember, everything about COVID-19, it's all about physical distancing. And even though sort of right now on the buses, you can only use every other seat, you're still not a full 6 feet away. So if you're able to ride the transit at a time where there's less traffic, you're going to be able to be more physically distanced from others. So that is certainly one other consideration, is to ask for a changing in your start time and your end time, so that you can ride at that time if you have to use the public transit. And then I would say definitely, if you're in public transit, you should be wearing a mask. You should be making sure you don't touch your face, your mask, your hair. Be careful about everything you touch. The concept is touch as little as possible, and use hand sanitizer. So use hand sanitizer when you get in, and use hand sanitizer when you get out. And whatever you've touched, don't touch your phone when you're on the bus. Don't touch the things, everything you touch while think of it as this is a dirty place. So whatever you touch that's common, think of it as being contaminated. You just have to get in that mindset. And whatever you touch when you've touched something that's contaminated is now your hands are contaminated, and everything you touch after that is contaminated. So you have to use hand sanitizer and use wipes to clean all of your things that might have touched. Keep things on you. Don't put things on the seat. Don't put your bag on the seat. don't hold on, to, like, if you try to sit, and just, really protect your hands, and hand sanitize as soon as you get out of the bus. And for others, people's sake, hand sanitize before you get in the bus, because you're part of that chain of transmission as well. And don't ride the bus if you have any symptoms.
As we reopen economies, as we flatten the curve, the risks are still there, and they're there until we have a vaccine, and a vaccine that is effectively distributed to our population across the country. That's still a long time away. So we have to be on guard today and indefinitely, certainly throughout probably to the end of this year, following those tips that you've just outlined for us. So I think a really good reminder for our viewers.
I think particularly for people who are immunosuppressed or have autoimmune diseases, they have to be constantly exercising the highest level of caution. And it's not like, it's not, I'm not saying this to produce anxiety about it. It just has to become a new way of operating until we have a vaccine. And when we have a vaccine, they'll be amongst the first to be vaccinated. But until then, it's just about protecting ourselves and learning how to do it in a way that is safe.
Finally, Dr. Lacaille, we want to talk to you about best practices as it relates to people who are going to continue to work from home. So we'd like to find out from you what sort of tips you can provide those employees who are going to continue telecommuting from home.
If you want this to be sustainable in the long run, there's some things you need to pay attention to. And I've noticed in my practice with my patients that, some patients are starting to complain of there are certain pains or issues that are arising partly in part of how they're set up at home. So I think probably the first thing that I would, recommend that people pay attention to is the setup of their workspace. That, unfortunately, many people might be doing this off of their kitchen table or on their sofa in their living room. And I think people have to realize that if you're doing this now 8 hours a day, 5 days a week, it's very important if you have arthritis. It's important for everybody, but particularly if you have arthritis, that you make sure that you have a setup that is ergonomically well set up. Otherwise, you're going to start to get some strain in some muscles and in some joints. So, the same basic ergonomic principle that we talk about for setting up an office also apply for working from home. So things like making sure that you have a good chair, that you have, a chair with a good support, that you're not doing what I'm doing right now, but that you're actually sitting back in your chair and leaning against the back of your chair, making sure that the height of it is good. And so generally the height of the chair is good if you're able to have your hips and your knees at the same level, so that your knees can bend at 90 degrees and then they touch flat on the ground. And if that's not the case, if in order for your chair to be at the right height, but then you might need to place something under your feet to have a good support. If you're sitting at the back of your chair, there should be 3 fingers between the back of your legs and your chair. That means that you've got the right depth. And then how you set up your table or your working space, same thing again, you need to make sure that it's at the proper level where your monitor, when your head is straight. The idea here is you always want everything, your joints, your neck, your head to always be in the neutral position, so that you're looking straight at your monitor, unless you have progressives, in which case you don't want it. You want it a little bit lower, because otherwise you have your head back like this in order to be at the right part of your glasses. And then the other part is your elbows and your wrists. You need to make sure that you can have your hands, I'm just going to move a little bit my camera, so that your hands are at your side, and I'm going to just back up a bit, so that your arms can be straight at your side and your elbows at 90 degrees. And the important part too is that your wrists need to be straight as well when you're on your keyboard, so that you're not going forward like this, but you're not going like this either. So, everything has to be in what we call a neutral, relaxed position. Elbows at 90 degrees, wrists straight, arms by your side. So making sure that you're able to set up your workspace to be able to do that is really important. And then making sure that you have everything around you, you know, so as long as you're not doing something where your head's always turned, or, you know, just those kinds of concepts are the big keys. So that's around ergonomics. I think the other really important things are around making sure that people, and actually that is also an ergonomic principle, people are spending a lot of time sitting now. You know, we used to at least get up to go to the meeting room before we had a meeting, or you would get up and go to the photocopy room, things like that. But so make sure that you're not sitting uninterrupted for 8 hours in your day. So making sure, you know, we usually say every 20 minutes, you should take a 20-second break and just do a little stretch and look away from your monitor and do a little stretch, and then you keep going. But you should also have little longer breaks as well throughout your day, so you're not hours on end without moving around. So the prolonged immobility, as we know, is particularly a problem for people with arthritis, because then they become stiff and more sore when they don't move around, as I'm sure that the patients know. And then the other thing is around making sure that you have a routine, like a starting up at the beginning of the day and a routine at the end of the day. It's very easy when you work from home to just, you know, let kind of work kind of slowly encroach on the rest of your time. And maybe, you know, when people are working from home and have to do childcare, your routine may be different. It may not be the beginning of the day and the end of the day, but try as much as possible to try to have a schedule and some kind of a routine, whatever is the routine that works for your work and your family, because right now we know that childcare is an issue. But trying to make sure that you have these set times and you have routines around that. Those are kind of some of the ensuring the work-life balance is a little more challenging in these times when working from home.
I think if there's any silver lining in all this, maybe it's all the dogs out there whose owners are now home and weren't home before and are going for more walks. So they're probably feeling that this transition's not necessarily so tough or so difficult. And while you're
talking,
I
think that the taking a walk is really important. And let's remember that even when the restrictions are at their height, you know, you are able to go for a walk, and going for a walk is something that is considered essential for our physical well-being, our mental well-being, and it's important for people to, and that's part of your schedule. Make sure you schedule it in your day to go for walks. And a lot for our patients with arthritis, I know you've had other ones around physical activity, but let's, you know, remember to build that into your routine of your day as well, to have some time for your physical activity routine from home or whichever way you're doing it right now, but make sure that that's not that's not skipped.
Yeah, and just another reminder for our viewers that a lot of this information can be found on Arthritis Consumer Experts website, as well as Arthritis Research Canada's website. Those are two really fact-filled websites with information around living and working with arthritis. We want to thank you again for your time today, Dr. Lacaille. Greatly appreciate it. And we want to welcome all of our viewers to join us again next week for another episode of Arthritis at Home. Thanks.
My pleasure.